I'm Stephen Bailey, Editor-in-Chief of Catheterization and Cardiovascular Interventions. And it's my pleasure to welcome you to this review of our upcoming edition 103.1. In this edition, we focus on some complex areas of catheterization and intervention. And I wanted to review some of what I thought were the most interesting articles. The first is applicability of JCTO channel score to predict microcatheter tracking during retrograde percutaneous intervention of chronic total occlusions, insights from the Surfing Micro Registry. This is reported by Piedimonte and colleagues and is from the Surfing Micro Registry, a multi-center group. This very interesting evaluation of 190 patients found that microcatheter tracking failure was related to the JCTO score, and within the technical aspects reflected small vessel size and multiple bends within the septal collaterals. And I think we find that there is some very good teaching points about our approaches to these complex chronic total occlusion cases. The second manuscript is balloon pulmonary angioplasty for chronic thromboembolic pulmonary hypertension due to septic emboli. And while it's a single case report, it speaks to a very complex area involving how we approach these patients and a reticence that we've had in the past in approaching patients whose pulmonary CT-EP is related to septic emboli. Steinberg and colleagues, I think, do an elegant job of discussing the difficulties and addressing how they approach this individual patient. And perhaps it will cause us to reconsider approaching some of these patients who are high risk, but potentially high benefit. The third publication is Optical Coherence Tomography Predictors of Side Branch Restenosis after unprotected left main bifurcation angioplasty using double kissing crush technique. Dr. Gupta and colleagues from India evaluated a small group of 60 patients, but using optical coherence tomography, they were able to show that the size of the side branch, those that were less than 2.8 millimeters, and the successful dilation of the side branch stent to greater than 90% were markers of outcome in this complicated procedure. And I think it, again, speaks to the ongoing issues that we have regarding how we can perform the best procedures in left main disease, particularly using the kissing techniques. The area of how to have optimal balloon I'm going to start this again. Please clip the other. The area of structural valve interventions have become incredibly important in our everyday practice, and evaluating the impact of simple but important aspects of this procedure are also clip, cut. Okay. The area of how we have optimal transcatheter aortic valve interventions is increasingly important with respect to long-term outcomes. And one of those most important areas is structural valve degeneration. What the impact of post-dilatation is has been hotly debated. In this issue, the impact of post-balloon dilation on valve durability and long-term clinical outcomes after self-expanding transcatheter aortic valve implantations was evaluated by Sanchez and colleagues in a multi-center retrospective analysis. And the particular question of does post-dilation of self-expanding valves harm the leaflets is very important. They evaluated over 1,800 patients. Approximately 1/5 or 22% had balloon post-dilation, and they found that at 6-year follow-up, they were unable to demonstrate any differences in terms of clinical outcomes, and specifically, no differences in structural valve deterioration. So that it gives us confidence, I believe, to optimize our initial valve outcome and hopefully contribute to improved patient outcomes in the long term. And finally, evaluating patients prior to TAVR, and particularly assessing who is going to benefit, remains one of our most difficult challenges. Certainly, frailty indices have been increasingly important. And one of those novel indices is the Naples prognostic score. And while this has been used in cancer patients to predict outcomes, it has not been previously applied to TAVR patients. In this issue, the clinical implication of the Naples prognostic score on transcatheter aortic valve replacement in patients with severe aortic stenosis was presented by Dr. Demirki and colleagues. The Naples score is something that is relatively simple and evaluates albumin, total cholesterol, the neutrophil lymphocyte ratio, and the neutrophil leukocyte ratio, and the lymphocyte monocyte ratios. And what they found was that in this study of 430 patients followed for about 40 months, that the predictive value, the hazard ratio for these patients was increased, as one would expect with COPD, to about 1.3. For CKD was 3, but the hazard ratio for this novel score was 7 in identifying those patients who were at high risk of mortality. So I'm excited about volume 103.1, the manuscripts that are included, and I think that you will find information in this issue that you can directly apply to your daily practice. Thank you very much, and I look forward to your feedback. And I appreciate your support of catheterization and cardiovascular interventions.